In America, nearly 50% of adults are facing cardiovascular disease. It is estimated every minute in America there are about 1.5 people facing a heart attack. Are you unintentionally inviting this risk by daily habits? Don't worry. This video will be a compass helping you over 60 years old identify and eliminate the silent killers, completely protect your heart. In the previous video, we together explored 4 golden keys to protect cardiovascular health. And as promised, today I will continue to reveal new keys, secrets even more in-depth and surprising to help you not only have a healthy heart, but also comprehensively improve your quality of life. Are you ready to explore? Let's begin. Your alertness and wise choices today will determine the health of your heart tomorrow. The 5th golden key to protect the heart of older adults lies not only in what we eat or how we exercise, but also in the very emotions within us. That is, relieve the slow exploding bomb, stress. Mind at peace, all matters at peace. The life of older adults is sometimes not easy at all. Worries about their own health, concerns about children and grandchildren, changes in life upon retirement, or sometimes feelings of loneliness all can become sources of stress, anxiety, or even prolonged anger, sadness. Many people tend to suppress these negative emotions, thinking, "Old already, endure a little," or "don't want to bother children and grandchildren." However, ladies and gentlemen, prolonged stress is precisely a slow exploding bomb for the heart. When we are stressed, the body releases hormones like cortisol and adrenaline. These hormones make the heart beat faster, blood pressure soar, blood vessels constrict. If this situation occurs frequently, it will erode cardiovascular health, increase the risk of forming atherosclerotic plaques, cause heart rhythm disorders, and eventually can lead to a heart attack or stroke. I have met not a few cases of patients with quite good diet and exercise regimens, but still encountered cardiovascular problems simply because they had to live with too much mental pressure. So, how do we remove the fuse for this slow exploding bomb? Don't keep it inside. Please share. If something troubles you, find a trustworthy person to share with. It could be a spouse, children, close friends, or even a psychologist if needed. Sometimes, just being able to express your feelings can help alleviate a great deal. Find joy in favorite activities. Make time for your hobbies. It could be reading books, listening to music, watching a favorite movie, gardening, painting, knitting, or joining poetry clubs, chess clubs. When the mind focuses on positive things, stress will gradually dissipate. Connect with the community. Don't isolate yourself. Participate in activities of local senior associations, groups of friends with similar interests. Social interaction and connection help us feel happy, understood, and less lonely. Practice relaxation techniques. There are many simple yet effective methods such as meditation, just 5 to 10 minutes each day focusing on your breath, deep breathing exercises, or gentle yoga exercises. These techniques help calm the nervous system, reduce heart rate and blood pressure. Maintain a healthy lifestyle. A balanced diet, sufficient sleep, and regular physical activity also contribute significantly to improving mood and the ability to cope with stress. Dear Quivi, mental health and physical health are very closely related. A peaceful, relaxed mind is a precious medicine for the heart. Never underestimate the power of emotions. Actively taking care of mental life, relieving stress in a healthy way, is just as important as eating or exercising in the journey of how to avoid a heart attack. Because when the mind is at peace, all matters will be at peace accordingly. Because when the mind is at peace, all matters will be at peace accordingly. The 6th golden key, an element often underestimated by many older adults, but which plays an extremely important role in protecting cardiovascular health, is golden sleep, charging battery for the heart. Illustration: image of an older adult sleeping soundly in a quiet, moderately dark room, contrasted with an image of a person tossing and turning or snoring loudly, or watching TV or phone late in bed. We often think that as we get older, the need for sleep will decrease. But, ladies and gentlemen, sufficient and quality sleep is still extremely necessary for the body, especially for our heart. This prolonged condition significantly increases the risk of hypertension, heart rhythm disorders, heart failure, and especially heart attack and stroke, particularly at night or in the early morning. Besides, the habit of watching TV or using phones, tablets, too late in bed is also an enemy of sleep and cardiovascular health. Blue light from these devices inhibits the production of melatonin, the hormone that helps regulate sleep, making it difficult for us to fall asleep and sleep deeply. Moreover, content from TV programs or social media can be stimulating, stressful, increasing heart rate and blood pressure, preventing the body from fully relaxing. Poor quality sleep over a long period will increase the risk of cardiovascular diseases. So, how to have a golden sleep to help charge the battery for the heart? See a doctor if there are signs of sleep apnea. If you or a loved one notices loud snoring, pauses in breathing during sleep, be brave and see a respiratory or cardiology specialist for timely diagnosis and treatment. Treatment methods such as using a CPAP machine can significantly improve sleep quality and protect the heart. Create an ideal sleeping space. The bedroom should be quiet, dark, cool. Use thick curtains to block light. Establish a regular sleep schedule. Try to go to bed and wake up at the same time every day, even on weekends, to regulate the body's biological clock. Avoid stimulants before sleep. Do not drink coffee, strong tea, alcohol, or smoke cigarettes a few hours before going to bed. Turn off electronic devices at least 1 hour before sleep. Instead, read a book, paper book, listen to soft music, or perform light relaxation exercises. Do not eat too much or drink too much water close to bedtime. Engage in light exercise during the day. Regular physical activity helps improve sleep quality, but avoid strenuous exercise close to bedtime. A good and sufficient sleep, about 7 to 8 hours per night for most adults, not only helps you feel refreshed, mentally sharp the next day, but is also an invaluable medicine helping the heart to rest, recover, reduce burden, and the risk of cardiovascular diseases. This is an indispensable element in the plan of how to avoid a heart attack. Please cherish every precious moment of your rest. Please cherish every precious moment of your rest. The seventh golden key, something that is probably no longer unfamiliar to many people, but its importance is never old. That is, say no to tobacco smoke, even secondhand smoke. Dear older adults, perhaps there is no need to say too much about the harms of tobacco anymore. It is the enemy of the entire body, and especially one of the leading causes of cardiovascular diseases, including the heart attack that we are trying to prevent. Even if you have smoked for many years, even decades, quitting smoking right now still brings enormous and rapid health benefits. Immediately after quitting smoking, your heart rate and blood pressure will begin to decrease. Within a few weeks, blood circulation improves, lung function begins to recover. After 1 year of quitting smoking, the risk of coronary heart disease, including heart attack, is reduced by half compared to those who continue to smoke. After many years, this risk can decrease to nearly that of a person who has never smoked. The toxins in tobacco smoke, such as nicotine and carbon monoxide, CO, directly damage the inner lining of the artery walls, creating conditions for atherosclerotic plaques to form and develop faster. They make blood clot more easily, increasing the risk of forming blood clots that cause blockages. Tobacco smoke also reduces the amount of oxygen in the blood, forcing the heart to work harder. And equally important, that is, secondhand smoke. Even if you do not smoke, but regularly inhale smoke from others, in the family and public places, you still face an increased risk of cardiovascular disease. There is no safe level of exposure to secondhand smoke. Therefore, boldly ask others not to smoke near you or stay away from smoky environments. Many older adults think, "Old already, why quit?" or "Smoking a little is fine." These are extremely wrong notions. Every cigarette is harmful, and it is never too late to quit. If you are having difficulty quitting smoking, do not hesitate to seek help. Talk to your doctor for advice on effective smoking cessation support methods, such as nicotine replacement therapy, patches, lozenges, or addiction cessation support medications. Joining smoking cessation support groups is also a good way. Remember, quitting smoking is one of the wisest decisions you can make for your heart and overall health. This is an indispensable step in the journey of how to avoid a heart attack. Every day without smoke is a day your heart is purified and healthier. Every day without smoke is a day your heart is purified and healthy. Salt, sodium. As we discussed in Key 2, fast food is often very salty to enhance flavor, contributing to hypertension. Sugar. Many types of fast food, especially accompanying soft drinks, contain very high amounts of sugar, increasing the risk of obesity, diabetes, risk factors for cardiovascular disease. Empty calories. They provide many calories but are very poor in essential nutrients like vitamins, minerals, and fiber. When we regularly consume these types of food, our blood vessels gradually get built up with atherosclerotic plaques like old sewer pipes clogged with waste. The heart has to work harder to pump blood through narrowed vessel segments, and the risk of a heart attack due to coronary artery blockage will significantly increase. So what is my advice? Minimize eating fast food and fried foods. Consider them occasional choices, not a regular part of the diet. Prioritize home-cooked meals, where you can completely control the ingredients and cooking methods. When eating out, try to choose healthier options. For example, choose salad instead of French fries. Choose grilled or steamed meat instead of fried meat. Choose water or unsweetened tea instead of soft drinks. Prepare healthy snacks at home. Fresh fruit, unsalted nuts, unsweetened yogurt are excellent alternatives to chips, packaged French fries. It may not be easy to give up these favorite foods, but think about the long-term health of your heart. Every smart food choice you make today is a brick building a strong shield protecting your blood vessels. This is an indispensable part of learning how to avoid a heart attack. Say no to the enemy of blood vessels for a healthy heart every day. Say no to the enemy of blood vessels for a healthy heart every day. We have gone through 8 golden keys, and now is the 9th key, a crucial element requiring close monitoring and proactivity from you older adults. That is, control the trio of killers: blood pressure, blood sugar, blood lipids. Illustration: image of a blood pressure monitor, personal blood glucose meter, and possibly an image of blood lipid test results, or an image of a doctor advising an elderly patient about these indicators. Ladies and gentlemen, hypertension, diabetes, high blood sugar, and dyslipidemia, high blood lipids, are often likened to a silent trio of killers for cardiovascular health. They are dangerous because they often do not cause clear symptoms in the early stages, making many people complacent, not detecting, and not treating them promptly until serious complications, including heart attack, occur. Hypertension. As mentioned, high blood pressure creates great pressure on artery walls, damaging them and making the heart work otirokic. This is a leading risk factor for coronary heart disease and stroke. Diabetes, high blood sugar. Prolonged high blood sugar will damage small and large blood vessels throughout the body, including the blood vessels supplying the heart. Diabetic patients have a 2 to 4 times higher risk of cardiovascular disease than normal people, and heart attacks in them are often more severe with a poorer prognosis. Dyslipidemia. Especially when bad cholesterol, LDL cholesterol, and triglycerides are high, while good cholesterol, HDL cholesterol, is low. This condition promotes the formation and development of atherosclerotic plaques in the arteries, causing narrowing and blockage of vessels. So, how to control this trio of killers? Regular health checkups are mandatory. This is the best way to detect these problems early. Older adults should have a general health checkup, including blood tests to check blood sugar, blood lipids, and measure blood pressure at least every 6 months to 1 year, or more frequently as directed by a doctor, especially if there are already risk factors. Know your target values. Talk to your doctor to know the ideal blood pressure, blood sugar, and blood lipid levels, LDL-C, HDL-C, triglycerides, that you need to achieve and maintain. This target may vary depending on the overall health status and comorbidities of each person. For example, target blood pressure is usually below 130/80 millimeters. HbA1c, average blood sugar over 3 months, below 7% for most diabetic patients, but individual doctors' recommendations should be followed. Monitor at home if necessary. If you have hypertension or diabetes, your doctor may advise you to monitor your blood pressure or blood sugar at home using personal devices. This helps you and your doctor understand the fluctuations of these indicators and adjust the treatment plan promptly. As we discussed in Key 9, lifestyle change is extremely important. However, for many older adults, especially when blood pressure, blood sugar, or blood lipid levels are already high, or when there has been certain damage to the cardiovascular system, lifestyle changes alone may not be enough. At this point, medical intervention, specifically the use of medication as prescribed by a doctor, becomes an indispensable part of the heart protection plan. Many people have an apprehension of using Western medicine long-term, fear side effects, or, when symptoms improve, indicators seem stable, they arbitrarily reduce the dose, even stop medication without consulting a doctor. This is an extremely dangerous mistake, which can lead to unforeseeable consequences, making the condition worse, harder to control, and the risk of a heart attack or stroke increases manifold. Medication prescribed by a doctor is a bodyguard protecting your heart. Medications for hypertension, diabetes, dyslipidemia, or blood clot prevention drugs, if necessary, are researched and prescribed based on your specific medical condition. They help control risk factors, slow disease progression, and prevent dangerous complications. Absolutely do not arbitrarily stop medication or change the dosage. Even if you feel better, it may be due to the effect of the medication controlling the condition well. Stopping medication abruptly can cause indicators to surge back, causing a very dangerous rebound effect. If you experience any uncomfortable side effects, report them to your doctor immediately for advice on adjusting medication or dosage appropriately, rather than arbitrarily stopping treatment. Take medication on time, at the right dose, in the right way. Strictly follow your doctor's instructions on how to use medication. You can use daily pill organizers, set reminders on your phone to avoid forgetting or confusion. Besides adhering to medication, regular follow-up appointments with your doctor are equally important. These follow-up visits are not just to get more medication. It is an opportunity for the doctor to reevaluate your overall health status and disease progression, monitor the effectiveness of the current treatment regimen, and detect side effects early, if any. Perform necessary tests to check important indicators. Adjust the treatment regimen, medication, dosage, if necessary to achieve optimal and safest effectiveness. You have the opportunity to discuss, ask questions, and resolve your concerns and worries with your doctor. Ladies and gentlemen, adhering to treatment and regular follow-up is not a burden, but a smart investment in your own health and life. It is a close collaboration between patient and physician to jointly achieve the highest goal: a healthy heart and a quality life. This is the crucial step, the life-saving key, completing the overall picture of how to avoid a heart attack and live long with children and grandchildren. Consider your doctor as a reliable companion on your journey to heart health care. The journey to improve health is a long road, and we are very happy to accompany you. To continue receiving in-depth analyses, new health keys, and practical advice updated regularly right on this YouTube channel, please remember to press the subscribe button and the bell icon. This is the best way for you to not miss any video that helps you live healthier and happier. Goodbye, and see you soon.